Hey, how's it going? My name is Dr. Dave Smaldone, and I'm here for a quick webinar with Dr. Brimhall.
All right, and this is Dr. Brimhall. We're mainly going to just turn it over to Dr. Dave and let him run with this. He's one of our homecoming speakers this year, and it's the first week of January. So we're just giving you a little taste of what you're in the store for. Dr. Smaldone spoke with us about 4 years ago and just had standing room only in his class. And it's taken me this long to slow him down enough to commit to come back and spend the weekend with us, January 4th through 6th, the very first weekend. So be sure you map that out and come and see us. We're going to be here in Arizona where it's nice and the good weather here. And even though it might be bad where you guys are, Dr. Smaldone was first a trainer and then wanted to be a chiropractor. And we're just going to let him run with it. He can kind of give you his background and go from there. Dr. Smaldone.
Hey guys, so I was an athletic trainer before I was a chiropractor. I've worked with lots of different teams, football, basketball, baseball, girls tennis, gymnastics, you name it. I've been very blessed in that I've been able to work with some of those teams. And I kind of carry this athletic training into my practice as well through kinesiotaping, which I originally learned kinesiotaping from a guy with one hand, but I'll leave that story for another day. So we got some cool things going on with kinesiotaping that a lot of other chiropractors really can't offer in their clinics. And it really will help make you unique in ways in that you would never think it would make you unique. For example, if I'm out and I have a patient who's taking a class, okay, and I have strength tape on them or some kind of tape that lasts a long time, other people will ask them, oh, what's wrong with you? Or, oh, where'd you get that tape? And I'm actually like known in the area as being like the taping chiropractor. So they'll say, oh, you went to Dr. Dave, he's awesome, right? And like all of a sudden I'll have 3-4 clients referred in just from taping one person. So it's not only a really great tool in order to be able to help people hold their adjustments longer, it's also a really great tool to help build your practice. I find that you can use it in a number of different ways. You can use it in ligamentous stability. So if someone has a sprain in a ligament, you can help them with muscular proprioceptive awareness during sports activities, or it can help with lymphatic drainage. The pictures, I don't know if you guys have ever seen, but there's like, people who have these hematomas, you can do these meshing patterns through it. And like when they take the meshing pattern off, it's like completely healed underneath it, like, and drained out. And then the checkers where it hasn't been taped is still like totally bruised. It's incredible. So, that's just some of the things that are pretty cool about kinesiotaping. And I'm just working on, let's see here. I'm working on my slides, getting them go up and down here. And I don't know why it's not going up and down, but I'm going to hit over to the slider here. So there's different kinds of tapes here. There's rock tape, spider tape, strength tape, Aries Perform Tech, original kinesio tape. I really stick with 4 brands. I like rock tape a lot. I think it's a great tape. Spider tape, strength tape is my tape. I've had people last 3 weeks with that tape on. It really is just a beast of a tape. So if you're looking for a good tape, go with the strength tape. And definitely not the KT tape. That's the junk that they sell to the average consumers. And I kind of get upset when I look at KT tape, because 18 years ago when I was an athletic trainer, we were one of the first people in the country to kinesio tape. And our boxes came over from Japan. Okay, so we had the original kinesio tape, and that stuff was like, you put it on and you had to take a warm shower to get it off, otherwise it was taking skin with it. So I see this KT tape and it like, it comes off in a matter of an hour or a matter of 15 minutes, and it just like, it almost infuriates me. So if your patients are buying KT tape, they're just basically having their money ripped right out of their pockets. rock tape, strength tape, spider tape. All those ones should last at least a week, if not 2 weeks, depending on their activity level, if they're swimming or not. Showers shouldn't really be an issue with them. Some of the really great things you can do, with strength tape is that it also has minerals for inflammation reduction. So it has copper, magnesium, calcium, and iron in it. So not only does it help support the muscles and the ligaments, it also helps by putting it directly onto the skin for absorption. A couple of things you want to talk to with your clients when you're talking about kinesio tape with them is that some people do have allergies, especially people with latex allergies will also have allergies to different kinesio tapes. So you got to make sure to ask them if they have any adhesive allergies. If they don't, great. If they do, then I suggest getting a hypoallergenic tape, which they do produce. Kinesio Tape Gold, I believe, produces the hypoallergenic tape. And also, like 3 days in, a lot of times what happens is your skin is a living, breathing organism. So it will dry out underneath the tape. And people think they're getting an allergic reaction, but that's not the case. The skin is just drying out. So if they take aloe vera lotion and rub it on in through the tape, that will immediately take the itching away. And you want to make sure to instruct them also to keep trimming it at the ends because you want to put ample on above and below the injury so that they can trim as the days go by. Because starting about day 3, it will start to peel there. Let's see here.
In your practice, about what percentage of your patients get taping?
I would say about 20 to 15 to 20% of people get taped. I see a lot of shoulder and knee related injuries, and those are the areas that that kinesio tape will shine in, besides the ankle, of course. But shoulder injuries, people who have rotator cuff injuries, people who have chronic bursitis and deltoid issues. The reason that the shoulder doesn't heal properly is that it's under a constant load. Gravity is constantly pulling on it while you're walking, the arms swinging and whatnot. So if we give it some support to negate gravity, all of a sudden with some chiropractic care, some of the cold laser that we provide, and the therapeutic exercises, they start to heal magically after like years of having. I just posted one. This girl had been in pain for like over a year, had been to 20 different doctors under the sun, and in 3 weeks we have her completely pain free.
So you're saying there's patients just flat would not get well if you did not add this to your armamentarium.
Yeah, because it's like constant damage that's being done to that joint, that ball socket. It's like it's one of the few joints that never really gets a rest. So people could have injuries that are just constantly irritated over and over and over again, and it would never heal unless you completely you put it in a sling, which people don't ever hardly do.
You and I were talking before we started today about all the different kinds of patients that come from different walks of life. Can you just give us an overview, like football, tennis, etc.?
Yeah, I mean, I have, I just saw a baby today who was, he was like, I think he was 3 weeks old, and then I see the UFC fighter who's 250 pounds and he's like solid muscle. So I have some really diverse patient population in my office. My favorite are the ultra marathon runners. They're a totally different breed of person, and I'm not sure that they are the same species as we are. These are the people that run the 50-plus-mile races and whatnot. They're just amazing individuals, but it's amazing to see the amount of trauma that their bodies can take and heal at the same time. That's a lot of trauma to take. But yeah, we have boxers, we have triathlon runners, we have gymnasts, we have cheerleaders, um, we have tennis pros. We have like one of the head Wimbledon judges who comes in for treatment, some of the top boxers in the world, former heavyweight champions who come in for taping and therapy. So I just wanted to go over, the a basic shoulder taping for you guys here. So this is position 1 here, in which we're going to be taping someone, and the arm is going to be flexed to 90, elbow to 90 degrees. You want to make sure that elbow's tucked in close to their body, and you want to come across the anterior part of the bicep and over the anterior deltoid and wrap it around the posterior deltoid and over the rhomboid, so it attaches in the middle of the back, which you can see right. I don't know if you can see my pointer or not.
Yes, we can very well.
Okay. So you see that it attaches close to the spine here. Here's the spine line. And that's position 1. So this taping consists of 3 different tape jobs there. And then this one is going from the middle delt. You're going to bring it right over the top of the shoulder and over the top of the trap. And then you're going to lock the top of the trap down onto the top of the rhomboid there. And also, if you notice her head position here, the muscle is in a stretched position while we're taping it. So that's something I'll cover when we go over in class why I want to do that. And here's the last piece, which I can't, there we go, now I can see it. You'll see that it comes over the posterior part of the tricep there, wraps around the front of the anterior deltoid and goes over the top of the trap here and locks down the top of the trap. So we're taking the tension off the trap by putting a cross tape job on top of it, and then we're pulling in the arm to the body, and then we're elevating it over the middle deltoid portion. So people usually feel like they have a nice, they'll feel a gentle pull up is what they should feel when you're done with this tape job. So I tell them, this feeling is not going to last. Usually within an hour or 2, the tape job has loosened to the point where they don't even feel the tape job anymore. It's like it's in a neutral position. Does that make sense?
Yeah, you bet. So you want
All right.
to do a little bit during there and just letting them know that it's going to relax a little bit as you go along.
Yeah, absolutely. Because they look at me kind of like I have like they look at me like, you really expect me to keep this on? Because it's a little on at first. You feel it like tugging up your shoulder. So this is, I actually had a couple from Nebraska come one time, and they stayed in their trailer for 6 weeks to get treated by me for frozen shoulder, and we resolved both of their frozen shoulders. So I do some fun little things when I speak. I usually do pop quizzes and I give away prizes and stuff like that. And I'll make sure you know your knee anatomy, because we're going to give out some prizes when we go over the knee anatomy. One of the most common parts of knee injury there is the medial collateral ligament. That's the most common, because what happens is a valgus force or an outside force comes from this direction and hits that center line of the joint and will gap the medial part of the knee. And that ligament tends to get trashed, basically. It's the brunt of it. Usually you're always going to have some sort of MCL involvement with knee injury just because of the mechanisms, unless someone is like running and planting and twisting. And then usually you're looking at a type of ACL injury. Let's see here, a couple other ones. And I really noticed that the knee tape job here provides a lot of stability, a lot of support, while them not having to wear brace. Like, I have so many patients who are like, this gives way more support than the brace, and it's less clunky. I can fit it under my clothes. I'm not embarrassed to wear it. You would be shocked at how many people don't wear their braces because they're embarrassed to wear them.
So that are listening, you can see why we're allowing 3 hours for him to teach this class and take the people in the class and to really get their hands on too. This is something that's going to, the visual application is going to be amazing to have that much time to do it.
So I have some really cool protocols, which I'm going to go over as well while I'm there. I'm going to go over my frozen shoulder protocol, which I've been doing for a little over 10 years now, and it really helps break up scar tissue adhesions and helps basically give them range of motion back within a couple visits. I just had a woman in today. She couldn't raise her arm past 20 degrees. And then when we were done, she could completely raise her arm over her head pain-free. So I'm going to go over that protocol, and then I'm going to go over a tibiofemoral adjustment, which is a really great adjustment. It's kind of cool. It's got like, it makes like a huge clunking sound inside of the joint. It's not your typical adjustment. We got a couple of different side postures, which we may go over if we have time, but I really want to cover a ton of the taping with you guys. So here's the first tape job for the knee. So we're going to go over the IT band, middle IT band here, or vastus lateralis. I mean, they're, you know, hand in hand. You're going to go over the joint. You're going to cover the LCL, and then you're going to come right across the front of the patella tendon here and put some good tension on that front of that patella tendon. And the second strip here, we're going to go right on the inside of the knee. We're going to come across. You see how this V forms right in the front of the patella? Well, this is a nice little cross section of tension that goes right over that patella tendon. And when you put tension on that patella tendon, it really will take pressure off of all these, you know, muscles up here, the vastus lateralis, medialis, all those. And then depending on where the injury is, what I like to do is I'll put a reinforcement band. So, let's see. So like for this person here, so if this person would have an LCL injury, so I would make sure to put an extra band right over across the LCL and strap it in the opposite direction. That way they have maximum stability on that side of the joint while they're walking, and you know, it helps kind of even things out. Let's see. And then the last step is to lock it out. So we put one strip right across the front of the knee here to lock it down basically. And this strip, tell them, is going to come off within a couple of days. It's just really meant to keep everything in order, and because there's a lot of tension on here, so if you don't put down this lockdown strip, these strips can pop up if the glue hasn't set completely yet. And I noticed like people with chondromalacia, this totally like helps resolve it. I mean, it's really wonderful for that. And then you can use it for the MCL, LCL, sprain, strain type deals, grade 1 and 2s. It will help support it and help it heal. You know, and I always hit it with like the quantum laser, you know, and I'll always hit it with like stim or ice as well. But if you're dealing with ligamentous injuries, you want to make sure that you guys are using a laser on top of it, because it really does accelerate the healing process. Let's see here. I don't even know what time it is. I'm just chatting away here.
You got a lot of time.
All right. Let's go for another ride here. Oh, so lateral medial epicondylitis. We developed basically there's a thing called a Chopat strap, which is basically like a little a band that goes over places. So I developed this technique a while ago, and it's basically rolling it into a roll here and then strapping down over top of it like that. So it's, say for example, they have lateral epicondylitis, which is, you know, originates up in this area. Well, we go 2 inches below it, and then we put that tension roll there, and then we strap around it, in a very specific way, which I'll have to show you guys. But you don't want to cut off blood flow to the hand and the arm while you're strapping this down with maximum tension. So you got to do it in a very specific way. Um, and then also I'll do like some nerve flossing with that, and some exercises with that, and of course the cold laser with that.
And
Um,
why do you tape it down that far below the elbow where the pain is in the elbow? It's that's something I wouldn't have thought of. So explain that to me a little bit.
Okay, so basically what happens is in these long muscles here, the tension is generated right above mid belly of the muscle, and the tendons are actually about an inch, inch and a half long within that uh, muscle. So they're very long, stringy muscles. So if the maximum tension is being created within the middle of the muscle belly, you want to just go right above there and cause a new uh, origin for that muscle is ultimately what you're trying to do, and take all the tension off of up here in order to allow it to heal as much as possible.
Amazing. I had injured my shoulder the last time you came and you taped that, and it wasn't 24 hours till it completely recovered. I've been babying it for 2 weeks. So I hope people can catch the vision of how many things you have innovated here above and beyond anybody else. And of course, the nutrition is so important too, adrenal support and even like the MagnaStem products and the Muscle RX, which helps the muscles and all the ligaments to heal. So we integrate the laser, the nutrition, and the taping is a real asset to us. So I'm so excited you're going to be there with us this year.
Yeah, I'm really honored to be with you guys. And, Doug, I really, I consider myself know a ton about nutrition. And when Doug starts talking about nutrition and the chemistry behind it and stuff like that, I, I, I get lost sometimes. I'm not gonna lie. But it's really cool in order to be able to take part in some of the great minds that are going to be there and share the podium with you guys.
You know, we look forward to you being there for sure. Of course, Dr. Harris, with his photographic memory and reading 4 different languages, he really puts us to shame. But he helps make sure we keep up with the literature, that's for sure, and everything that we do these days.
So I'm going to field some questions if some people have some questions for me. I'm not sure.
Any other joints you want to show us before we do that? How about
Uh,
cervical taping? That looks interesting.
yeah, we could do the cervical taping here. So with the cervical taping, the main stability muscles that we can tape are the levator scap and the trapula and the trap. And I do these positionally. So what that means is that I won't put a ton of tension on the tape itself. I'll put the person in tension and then I'll tape over it gently. And what that allows it to do is it allows the person to go into maximum range of motion, and then when they come back up, they're they're basically there's no tugging on them. But once they go into their range of motion, they'll feel some support and help pulling them back. So the first position for a cervical tape job is I'll have them bring their head forward flexed all the way, and I'll put it at the base of the skull. You want to try and not get their hair. If they do have a hairy neck, it's always nice to have a razor or an electric shaver around the office. I have one in each office actually. You've got some hairy guys. What can I say?
Right.
So, you're going to need that if you want to take like somebody's knee or somebody's shoulder or, somebody's back. I mean, there's lots, there's lots of guys with hairy backs. So anyways, you go head first forward, and you're going to put at the base strip there at the base of the skull, and you're going to put zero tension on there. So you can see it's just hanging there. There's no tension on it whatsoever. And then I lay down the tape all the way down into the mid back, covering that portion of the trapezius muscle, and also where the rhomboids insert into, which is the lateral transverse processes of the spine. And then I'll have them laterally flex and get some tension on that trap right there. And I'll run it all the way from the, I don't know if you can see it or not. Hold on. Sorry. This box, this chat box that you guys can't see is in my way. So yeah, it goes all the way down over the insertion of the trapezius and right on top of the shoulder there. And that just gives it some support during the range of motion. So someone actually asked me last time, what's the difference? Why do I go along the muscles here, but in the other tape jobs, I'm doing a cross pattern, right? So what happens is in the tape jobs that I do, if I'm looking for ligamentous stability, if I'm looking to lock a ligament down, I cross the ligament with the tape. But if I'm looking for muscular support and proprioceptive input on the tape jobs, then it always goes along or parallel with the muscles. Do you see that here?
Yes.
So that's an important concept to grasp. Otherwise, you can, stop range of motion in an injured muscle that actually needs to move in order to pump out any fluid in it. So you want to be able to allow range of motion, but you want to have pain-free range of motion. So when I'm doing like physical therapy, not physical therapy, but activities, daily life and exercises and whatnot, I always tell my patients, never do exercise within your painful range of motion, because if you're doing exercise in your painful range of motion, you're training your body to say that range of motion causes pain. So a lot of people will have them, oh, just muscle through it, or oh, it's the good pain. There is no good pain when you're in therapy. And that's a concept a lot of athletes really have trouble, they have trouble grasping it, because in their life, pain means gain. But when you're injured, pain does not equal gain. Pain equals longer recovery periods.
Now, when you're taping it, it's going to reduce a lot of the pain and allow them to do things they could not do without it by far, correct?
Yes. Yes, it does give some proprioceptive feedback to the brain and stimuli, which will kind of counteract the pain mechanism for them. Let's see here. Do we have another? I'm on that one. Good. And there's a nice shot of the. Sorry, there's a background noise there. That's a nice shot of the tape job, nice and even. Feedback is the same on both sides, the corners of the shoulders, and you can cause yourself to have equal tape jobs if you cut them together. That's the key. If you're doing a parallel tape job, is to cut the slices together, and once you do that, everything becomes much easier.
Now, I see some tape companies actually have these pre-formed tapes for different situations. Are those helpful or counterproductive?
Honestly, I find that they're a ripoff, to be honest with you. If you like, I can show you how to cut this tape job in less than, 30 seconds. It's a snip, snip, and a right up the center. And, if you're looking to buy one of those pre-cut things, they're like $6. This is probably $2 worth of tape. So, if you're looking at a profit margin, you're either looking at an $8 profit margin versus a $4 profit margin. So I always think, different people are different sizes or different lengths, have different muscle lengths and whatnot. If I can customize it and do it 3 times as cheap, why wouldn't I?
Right. And what do you charge if you're going to tape somebody? What's the additional charge to your normal?
So I charge $10 additionally. If there's 2 areas, I'll charge $20. And I charge by the body part. So if they have 2 wrists, it gets taped to, $20 extra per visit. And the amazing thing is people have no problem paying for it. People don't, sometimes want to pay for things, but the tape, they're more than happy to pay for it. I think it's like the laser, Dr. John.
Right.
the technology, you know.
You just
So if
can't get the
anyone
same
has,
results without it. And I'm sure
what's
by the time somebody gets to you, they've probably seen 10 other people many times.
well, usually I'm the last person that they see, and that's all that matters.
Exactly. I agree.
So, you know, it's nice to feel that way when you know you can help somebody and you have the tools in the toolbox. And that's what I really see this as, you know, it's just another tool in the toolbox to help your chiropractic practice and your chiropractic philosophy. This doesn't adjust people. This isn't some kind of machine. You know, this just basically helps the body hold the adjustment, which is really what I'm all about. And that's why I have my patients do exercise as well, because it helps them hold the adjustment, not because I think the exercise is going to heal them. I think the adjustment is going to, you know, initiate their innate and their body is going to heal them. But if I can help that innate work along better, I will.
Well, so the doctors listening and those coming to the seminar can relax a little bit. We'll get Dr. Smaldone to give us copies of these. And so, and as he applies them, you guys can take notes, write on the notes we'll have available for you. So Dr. Smaldone, you and I can work on that here in the next couple of months to make sure that they have what they need to be able to duplicate this, because you've taken years and applied it to very specific cases. And why don't you share a couple of cases with us now?
So I had a woman named Snow one time, and this is going back a long, long time ago. And she wasn't even from the country. She flew in, and she gave me permission to use her case or whatnot. But she was getting ready to have spinal surgery, and she had 3 disc herniations in her neck, MRI confirmed spinal stenosis in her it was I believe it was intervertebral foraminal stenosis going on there, and she had this pain down her arm and she couldn't use her arm at all. um, and they wanted to do surgery on her. I mean, rightfully they, you know, had reasonable cause to do surgery. So I started examining her, and I looked at her, and i I started palpating her, and she didn't like present. Like, I did a compression test on her, no increase in symptoms. You know, I did Sperling's, no increase in symptoms. I started palpating her arm, and she started like wincing. Now, all of us as chiropractors know that we're not going to irritate a nerve root if we're pressing on a muscle belly or something like that, right? If it's a disc injury, it's not going to be pokeable, right? So I all of a sudden I push on right over her radial head, and I feel it kind of like it's squishy, and it's like moving in and out. And the first, not the first, the third tape job I showed you, that lateral epicondylitis tape job with the round piece of tape, I actually moved it up right over to the radial head there to put pressure directly on the radial head. And I taped over her radial head with that compression band there, and it held it in place. And for the first time in like years, she had no pain whatsoever. And she was like crying, hysterical. I mean, like, you know, and there was no pressure on me because she only came from China to come and see me. I mean, you know, um, but she ended up not having surgery, and what she had a chronic dislocation uh, or subluxation, literally, of her radial head, and that's what was causing her radicular pain in her arm. So for a 25-cent piece of tape, we fixed her from having to have spinal surgery, which was pretty crazy to me.
Yeah, which not have resolved it at all because it wasn't the cause of the pain.
Exactly, exactly. She would have gone through the surgery and she wouldn't have had any resolution whatsoever.
Do you,
And I've
can you,
I've had a lot of Oshkosh Slater's kids come in who are having the knee pain because of the patella tendon pulling on it. And that tape job that I just showed you tonight. takes all the tension off of that patella tendon for them. So, it just assists the body in being able to heal. Osgood-Slater's is self-limiting thing. So as long as it gets rest, it will heal itself, which is what that tape job does, is take pressure off that tendon so it can heal at the tib tuberosity.
Doc, go ahead and click on the lumbar taping. It looks not too complicated. It's something we could do pretty easy. Great. Kind of explain that one to us.
Well, we got a little plumber's crack going on here. I might need to edit that.
You have to say no to crack on slides.
So, I don't understand the crossbar here. This is not my slide. This is somebody else's slide who I stole, because I wouldn't take a picture of the crack, but I definitely wouldn't do a crossbar. A lot of people do these crossbars in the back and they don't do anything. They feel no difference whatsoever. You're just wasting tape. So you want to provide proprioceptive input into the muscle, which is what I talked about, right? So this is a locking down. If you're going across, you're trying to lock it down. But there is no locking down of these muscles because they're so long in the spine. We know they go from head to crack, basically. So literally. So the best thing you can do is do these black strips right here up and down the lateral part of the spine, and I'll do them pretty high. Like if someone has a low back problem, I'll go right almost like below the crest here, and then I'll go all the way up into their mid back to really hit that spinae muscle there and give it lots of support. And one of the big things is you want to make sure to tape accordingly. So like this tape job is acceptable for this guy, but if you have someone who's like, 400 pounds or is a complete beast, like in the gym or anything like that, like you're going to have to put some extra tape on their back. Otherwise it's not going to do the proper job. So that's what, I like this tape job right here because it's giving this guy lots of support. It's a great example of it.
And so this guy, you would assume, had back pain and
Yeah, I mean,
back during exercise or competition?
yeah, I mean, obviously, I can't throw a diagnosis out there from that, but most likely he had some kind of low back strain right there going on, and they're trying to give those muscles, these muscles come back and contract, and when they contract, they need some extra proprioception in order to stop the pain response.
It allows it to heal at the same time.
Well, during rest, yeah. This guy doesn't look like he's resting too much, though.
Right. Exactly. So again, there's laser would come in real good. What about something like an Achilles heel? I don't know if you have anything to show us there, but could you kind of talk us through how you might support a foot like an Achilles tendonitis?
Yep, I got one. Whoa, that was weird.
That wasn't any fun.
How did that happen?
I don't know.
Quit unexpectedly.
Yeah, I don't know how to help you. I'm not an Apple man, so I don't know how to do that.
You might have to right click on the icon down below and force quit.
Here?
Yeah. Quit. There you go.
There we go.
There you go.
Good job there.
That's Aaron. He's our genius, so that's great. Thanks. Are there any questions coming in, Aaron?
Yeah, there's one.
While he's doing that, he maybe can answer the question.
All right. What do we got?
Anything specific for supporting a lateral meniscus which has been surgically repaired? Athlete is playing a rover on high school football team.
All right. So, well, you have a surgical repair there. So, obviously you don't want to be making any, you don't want to be telling them that it's doing something that it's not. I basically what I would do if I was taping that patient, let's see, I'm going to go back up to the knee that way. You guys can see my screen, yes?
Yes, perfectly.
Okay. I basically, I would go I would do that lateral strip along the outside there. There we go. Go nice and slow. That way it doesn't crash on me. There we go. All right. So this is basically the tape job that I would use for a lateral meniscus and an LCL supportive type tape job. Um, Honestly, if there was no medial involvement, I might even leave this cross strap out of the equation. So I would just basically do one right across the front of the patella, one right across the lateral side here, and then I would do a lockdown across the front there. So if there was no, patella tendon involvement and no MCL involvement, I would just basically do 3 straps and maybe even 4, 3 crisscrosses in a star pattern, which I'll show you guys when we get there. But you can kind of get the mental visualization of a star pattern. It's 3 strips like crisscross over each other and then locked down in the center with 1 strap.
Now, post-surgically, anything, it looks like tape would make sense to support that so you don't re-tear it, but allow it to heal up. Is that correct?
It does. It does support it a lot, but in a post-surgical situation, to protect yourself from liability, I don't know how far post-surgical this person is. You know what I mean? Like if they're directly
Right.
post-surgical and they're in a rehab scenario, their doctor is going to give them an orthopedic brace, and you're going to want to let them use it, even though we all know that those braces really only will give someone between 10 to 15% maximum support with lateral sway. But, you don't want to be held liable if something, God forbid, did happen. But now, if this is something that's a long term, it's been going on for years and is post surgical years and whatnot, and they're completely out of a brace and they're not under the doctor's care, then yeah, this is fine. You can give it tape to give it to some support during activity.
See if you can go down to that Achilles very carefully. Or plantar fasciitis.
All right, let's see here. Here's the Achilles. Okay, so one of the main things you have to tell every single person if you are treating an Achilles is that it could detach. I mean, that's the harsh reality of the situation. Someone with Achilles tendonitis has an Achilles tendon injury. And God forbid if you're doing myofascial release on it, if you're taping it, if you're doing anything and it does detach, they're going to want to blame someone. And most likely it's going to be you if you're treating it. So you got to give them a heads up before anything happens. So one of the first things I tell these people is I'm like, listen, you have a serious injury going on. You need to be under the regular care, of your chiropractor. And even at that, this tendon can rupture. There's no doubt about that. It's already partially torn. So at that point, those patients get it's right through their head immediately that this is a serious situation and that they need to be making their appointments on time and they need to be getting therapy immediately.
What about plantar fasciitis?
Yeah, I have a plantar fasciitis as well in here. You want me to go over to that or you want me to do the Achilles tendonitis?
Both. We're not greedy.
All right. So with the Achilles tendonitis, I noticed a couple cool little things here. We got so anyone, especially the women, they like excuses to go out and buy new shoes. So I tell them that they have to buy 3-inch heels. 4-inch is better. Those platform shoes that they have. Those are really great for allowing them to heal the Achilles tendon because of the position that it puts in the foot. a kind of a plantar flexive foot and takes tension off the Achilles tendon. And biomechanically, it just makes sense. You know, there's no tension on it during the day, and it can heal better. And that's definitely one of the tricks that I used. Cold laser, of course, nutritional support. You know, anytime you're trying to heal ligaments, you definitely need nutritional support. It's not going to heal unless they're getting the proper minerals and vitamins and whatnot. They want to be stretching it regularly and using some anti-inflammatory mix. I really like the Acute, the Optimal Health System that Doug there has. It's enzyme based and it's been clinically tested and researched, and it's just a great product, period. So here's the Achilles tape job, a tendonitis tape job, and a couple things you'll notice here. Most people will only tape. Let me see if I can get this into it bigger. Most people will only tape this area here. And the reason why we have such success with treating Achilles tendonitis is that we understand that the kinetic chain doesn't just occur here. And most of us as chiropractors do understand that, but we don't take the treatment to that, right? We'll only laser here, or we'll only myofascial release here. But when you're having someone with chronic Achilles tendonitis, 90% of those people are going to have some form of midfoot plantar fasciitis going on, and they're also going to have some kind of gastroc issue going on. So you're going to need to strip all the way from the mid gastroc down into the Achilles and then into the midfoot as well, in order to be able to take tension off of this Achilles tendon, because the Achilles goes to calcaneus, right? You know, the knee bone's connected to the hip bone, all that stuff. Let's see here. Get my thumbnails back. There we go. So
Down to plantar fasciitis, you're right there, and we'll end on that.
all right. So a couple different things: cold laser, adjust the ankle, calcaneus, midfoot, and of course with all of these things, I'm, you know, with the knee, I'm adjusting the knee. With the shoulder, I'm manipulating. I'm doing range of motion. I'm adjusting them. So I'll be doing that at the seminar as well. I'm not just going to be, you know, tape this like this, tape this like this. I'm going to go over the whole treatment protocol that I use for all of these things. So you can pick up like lots of the little tips that I use on all our athletes here.
On that bottom where it says barefoot movement, big advantages, 5, 10, 20, 40, what do you mean?
So the barefoot movement basically is a movement where they've done research on, you know, does the foot progress whether you're giving it arch support or whether you're having them do barefoot activities. So if you're doing barefoot activities, they have shown big leaps in research, basically showing that it brings you almost back to a primitive state, and it helps you develop gastroc strength, stability. Your arches start to raise, almost like you're in the wilderness. So it's a really cool thing. You can look, if you Google barefoot movement, you can kind of see some of that stuff there.
Right.
Yeah,
keep rolling down and show us the taping for that.
All right. So plantar fasciitis here, we're going to start around the metatarsal head here. We're going to wrap all the way around the calcaneus and then back to the first metatarsal phalangeal joint there, metacarpal phalangeal joint, metatarsal, excuse me. Let's see if we can get a top view. Oh, so this is the top view here, and it wraps around, and then we have 3 strips that go on it here. So the first strip goes down at the base of the calcaneus under the foot here, wraps around the foot, and you see this like little peephole window here. This allows the fat of the calcaneus to come into this nice pad here. So you don't want to tape over that. You want to leave that. and you're gonna hit right where the plantar fascia goes into the calcaneus here, and then you're gonna overlap it by half of a strap here, here, and it depends on the size of the foot. You may use 3, you may use 4 strips. She here has a pretty small foot, so I only use 3 strips on her foot, but if it's a guy with a bigger foot, you're probably going to use 4. And you never want to go above the metatarsal heads here. You want to stay right here, basically. And then lastly, you're going to go over the outside again to kind of seal it over again. So sometimes I'll go over the outside and I'll go over the top if someone's very active or they're in a lot of water, because the water can leak down into the tape job. So it kind of put like a raincoat over top of it to help it.
So this helps people heal a lot. I've seen those to be pretty darn stubborn on some people.
Yeah, and so I go to TheraTape.com to get my tape, and they give you lots of good discounts. And bulk rolls are definitely the way to go. So I see people buying these single rolls. You don't want to buy single rolls. You want to go out and buy the bulk rolls, which will save you guys a ton of money. So I usually, I'm not sure exactly what I pay, but they're between like, $70 to $80 for a bulk roll. And if you were to buy these little single rolls, it would probably take, 20 rolls to equal just one of those rolls. So that is some of the stuff for tonight. I appreciate you guys having me here.
Well, I think everybody that's listening to this can hardly wait for you to be there. We wish it was sooner now. And see that 3 hours may not be enough. Might have to have you back 6 hours next year. Once we get this, start practicing doing it. You and I'll work on getting the pictures ready so they can see what you're doing and be able to go home and apply it. Dr. Smaldone, we really appreciate being on tonight. We look forward to seeing you in January at Homecoming 2019. And thank you everybody for joining us. We'll see you soon.
Have a good night.